So today we are going to discuss about the lung mechanics. So how will you define lung mechanics? The study of the forces and factors which is responsible to take the air in and out of the lung is called as lung mechanics. Again repeat, the forces and factors which is responsible to take the air into the lung and out is called as a lung mechanics. So basically we are going to discuss 5 forces. 2 forces will be studying about the pro-expansion forces of the lung, that is the forces which is favoring the expansion of the lung, that is called pro-expansion forces, and we'll be discussing about 3 anti-expansion forces, that is the force which is resisting the expansion of the lung, right? So the two forces are pro-expansion force and 3 anti-expansion force, right? So here in this topic we have to study about the the bucket handle movement, pump handle movement, all those things will be included, but I am skipping those topics. So we directly go to the forces which is acting on the lung. So first is pro-expansion forces. Pro-expansion forces means the forces which is favoring the expansion of the lung. So which is the force which is favoring the expansion of lung? That is basically the contractions of the muscles, that is diaphragm muscle and the external intercostal muscles. When they contract, they create a force for the lung to get expand. So these forces are called as a pro-expansion forces. And 3 anti-expansion forces, that is 2 means, one is diaphragmatic force and the force applied by the diaphragm, and other is force applied by the external intercostal muscles. And 3 anti-expansion forces are, first is the elastance of the lung itself. Now the elastin is made up of, the lung is made up of the fibers, elastin fibers, and which will see when you expand the lung, due to the elastin fibers, it will try to recoil. So that is the force, the elastin force of the lung itself is preventing the expansion of the lung. That is anti-expansion for all the forces which is acting inward direction. That is anti-expansion forces. So first is elastance of the lung, and second is the tissues. Tissue in sense, the tissue resistance. Tissue resistance. So here you will be discussing, the lung is covered by the parietal pleura and visceral pleura. When the lung is expanding, the friction between the parietal pleura and visceral pleura will resist the expansion of the lung. So thank God there is a fluid in between the parietal and visceral pleura, so which reduces the this tissue resistance. And third anti-expansion force is airway resistance. So these are airway resistance, again it's a big topic, we are not going to discuss airway resistance. So these are the forces and factors which are favoring and resisting the expansion of the lung. So now, so before going to lung mechanics, I would like to explain about a few different pressures which is acting on the lung, pressures acting on the lung. So, see there are, there are alveolar pressure, you might have heard all these pressures, alveolar pressures, intrapleural pressure, barometric pressure, and transmural pressure. Transmural pressure, there are different types of transmural pressures like transpulmonary pressure, transthoracic pressure, transrespiratory pressure. There are so many pressures are there. So we'll discuss one by one in short. So first is alveolar pressure. So this is the what pleura? This is visceral pleura, which is lying closer to the lung, and this is parietal pleura, and again visceral and parietal pleura, and this is alveoli, and these are the ribs, cut section of ribs, and this is diaphragm, and these are the intercostal muscles, right? So you know that the visceral pleura is closely attached to the lung, and parietal pleura is closely attached to the ribs, inner surface of the ribs. So coming to the pressures, I have told there are 3 pressures, total 6 pressures are there. One is, this pressure is called as alveolar pressure, right? The pressure which is inside the alveolus or inside the lung. And this pressure is, what pressure it is? Intrapleural pressure. The space between the parietal pleura and visceral pleura, it has a negative pressure. So this is intrapleural pressure. And this is atmospheric pressure, that is barometric pressure, right? So these are the 3 pressures across the lungs, right? Alveolar pressure inside the alveoli, pleural pressure, and barometric pressure or atmospheric pressure. You know the atmospheric pressure is 760 millimeter of mercury, atmospheric pressure 760. So in respiratory system, 760 millimeter of mercury is considered as a 0. And in respiratory system, the 0 number is given to 760 millimeter of mercury. So it is represented by 0, right? Okay. And next we are going to discuss about the transmural pressure. So these are the 3 pressures: alveolar, and third is barometric, and second is intrapleural, right? So now coming to next 3 pressures. So I'll redraw the diagram. So this I had drawn one is single alveoli and the chest wall, right? So this single alveoli represent both the lung, right? Imagine this is 2 lungs, and these are the chest wall, and this is the diaphragm. Diaphragm is here, and these are the intercostal muscles, right? So, and where is the pleura here? Pleura is, this is what pleura? Visceral pleura, and this is parietal pleura, right? Parietal pleura is attached to the inner surface of the ribs, and visceral pleura is attached to the pleura, outer surface of the lung, right? Okay. So now what is this pressure? I have already discussed. What is this pressure? Alveolar pressure, which is inside the alveoli. And this pressure is between pleural space. This is intrapleural pressure, and here is the barometric pressure. Actually, I had drawn that there is a gap between the parietal pleura and visceral pleura, but there will not be that much gap. Right? It's actually closely attached. Both the pleuras are attached closed. Okay. So now next coming to transmural pressure. 4th pressure is we will be discussing transmural pressure. So what is transmural pressure? Transmural pressure is the pressure across the walls of any structure. Walls. Transmural pressure are the pressure across the wall. For example, suppose for example if I want to inflate the alveoli. If I want to inflate the alveoli, what I have to do? I have to, either I can inflate the alveoli by positive pressure, right? When you give pressure, positive pressure here, this alveoli is going to expand. So in that way you can inflate the alveoli. Second is, you apply the negative pressure on the outside of the alveoli, and it will suck the alveoli. When the alveoli is sucked, again air is going to enter. So alveoli can be inflated either by giving positive pressure or by creating negative pressure outside the alveoli, right? Okay. So what is transmural pressure? So suppose if you want to expand this alveoli, the inflation or the expansion of the alveoli depends upon the pressure difference between inside the alveoli and outside the alveoli. Pressure difference between inside the alveoli and outside the alveoli. For example, so how what is first transmural pressure is? First transmural pressure is the pressure difference between inside the alveoli and pressure difference outside the visceral pleura. This difference across the wall of the pleura, wall of the alveoli. That difference, pressure difference, will determine whether the alveoli will inflate or the alveoli will deflate, right? So what is this? This transmural pressure is called as transpulmonary pressure. Transpulmonary pressure, right? So what is the transpulmonary pressure? Pressure of alveoli minus pressure of pleura, pleural pressure. This pressure is called as transpulmonary pressure. So this is first transpulmonary pressure. Then, so what is the, okay, first is, what is the alveolar pressure? Alveolar pressure is, okay, we'll discuss second transpulmonary pressure. Transmural pressure, first transmural pressure is transpulmonary and second transmural pressure is transthoracic pressure. Thoracic pressure, that is pressure difference between inside the chest wall and outside the chest wall, right? The difference, pressure difference. So what is the inside pressure? Pleural pressure. Intra, this is 2, that is 2 minus 3. First is 1 minus 2. What is 1? 1 is intra alveolar pressure and 2 is intra pleural pressure. 2 minus 3. 2 minus 3 is the pressure difference across the walls of the thorax, right? So this, what is this difference? So this pressure difference from here to here. So this pressure difference is called as transthoracic pressure. What is transthoracic pressure? 2 minus 3, that is pleural pressure minus barometric pressure. Barometric pressure is atmospheric pressure, right? Okay.